Assalamualaikum. My name is Nurul Haifa binti Nur Azlan.
Assalamualaikum, my name is Muhammad Shahrul bin Aidil.
Hi, my name is Ahmad Ramadan and good evening. Today, I would like to talk about our final year project that is Home vs Office, Incorporation of Mental and Emotional Health. First of all, what is telework? Telework, also known as teleworking or telecommuting, involves working from home or you would need to keep in contact with manager or organization by using modern technology and telecommunication. Teleworking allows people to work 1 or 2 days a week or full time, either at home, in a local Wi-Fi cafe or a local telework center. To carry out job duties from a remote location, the teleworker uses communication tools. The activity has become much more popular over the past 20 years. According to Goddard 1994, says that as a relatively new work form, telework is perceived as having increasing potential, especially in areas with low level of infrastructure. However, according to Golden et al. 2006, one state that telecommuting on work-family conflict has become equivocal, asserting that telecommuting enhances work-life balance and reduces conflict, or countering that it increasing conflict as more time and emotional energy are allocated to family. Some even state that telecommuting has a differential impact on work-family conflict, such that the more extensively individuals work in this mode, the lower their work-to-family conflict. But the higher their family to work conflict. This in return will then increase the negative feeling that one will have. According to Mann and Holsworth 2003, they state that the negative emotional impact of teleworking, particularly in terms of such emotion as loneliness, irritability, worry and guilt, and the teleworkers experience significantly more mental health symptoms of stress than office workers and slightly more physical health symptoms. In 2019, the world has been shocked with a new strain of coronavirus disease that impacted all walk of life, young or old. This then creates a new definition of work from home, or better known as WFH, work from home. Is here to stay for an indefinite time, says Saluddin et al. 2020. The new definition of teleworker automatically broadens and has been applied to all those that work from home due to the coronavirus impact. This is to reduce and prevent the spreading of coronavirus disease until the vaccine is available to the public. Thus, a new norm has begun to emerge in our daily life. Therefore, the study found that prior to adopting telework sample, teleworkers tended to underestimate positive and overestimate negative experience of telework, says Maruyama and Tize 2012, in which may affect their mental and emotional health. Our first problem statement is working at home will lead to decreased interruptions by Bailey and Kirtland 2002, a widely cited cause of stress and negative workplace effects, according to Jed and Josh 2003. Second, telework reduces the commuting time, according to Peter et al. 2004. And according to Guskowska 2004, reduced commuting times may minimize adverse effects in many ways, such as providing the opportunity for more sleep or exercise, both associated with fewer adverse emotions, and by reducing the amount of transport-related hassles and costs. In addition, researchers predict that the combination of decreased commuting time, fewer work-related interruptions, more autonomy, and more control will result in less negative effects on workers while teleworking than when working in the office setting. Generally, the research objectives of this study are to compare whether there is a difference in the mental and emotional health of employees when working at home and office. Second, to determine the factors affecting the mental and emotional health of employees while working from home compared with the office. This study is designed to answer the following question. Is there a difference in working at home compared to the office on the emotional health of employees? Second, is there a difference in working at home compared to the office on the mental health of employees? Third, what are the factors that affect the mental and emotional health of employees while working from home compared to the office? The research hypothesis H1, there is a difference in working at home compared to the office on the emotional health of employees. H2, there is a difference in working at home compared to the office on the mental health of employees. Significance of study. This study is significant for the society, especially for the employees that have to deal with telework because of the COVID-19 outbreak in Malaysia. It will help them to improvise the knowledgeable action towards teleworking and have a better understanding of how telework differs from office working. Besides, the most and least factors that contribute to the current mental and emotional health of employees, whether telework or working in the office, can also be identified. This study also will benefit from colleagues and friends. It can help them on how to adapt to teleworking. In addition, the study will benefit colleagues and friends how to cope with mentally when dealing with teleworker and office working. Constructive informal communication with coworkers may positively influence organizational commitment and job satisfaction. Furthermore, this study can be useful as a reference for academic purpose. This research will be beneficial to the employer as well. They have to know how to deal with their employees' mental and emotional health. A good relationship between teleworkers and their employer is also as important as positive relationship that may lead to a greater job satisfaction, greater organizational commitment, increased job performance, lower intention to leave the organization, and career progression. Although teleworking results in new boundaries between work and home, and supervisory staff may be wary of crossing boundaries into teleworkers' personal life, which might be perceived as an invasion of privacy. This study is significant for the teleworkers and their families when dealing with the current global pandemic situation, giving them no choice but to work at home. They need to be equitable between their work life and commitment to families. Scope of the study. This research focuses on the employees in Negeri Sembilan as the study population. Hence, the target population for this whole study is for those who are working whether at home or office during this pandemic, COVID-19. Limitation of study. Due to spread of COVID-19, which has become worse due to third wave, a gathering of data is limited as we are facing the new norms. The limitation of the study is that since the world has been spread with the pandemic illness, researcher is unable to conduct face-to-face interviews. It will be conducted through online survey due to order of the government. Thus, the ways of gathering the data are through an online questionnaire. However, to respond to the questionnaire, the presence of the data connection is extremely necessary. Not at all places have a good coverage for internet users. Even more so during the rainy season. That also includes those who have exceeded their monthly use of data limit. Furthermore, some of the respondents may not be available for data collection due to their busy schedule to respond to the questionnaire. They can also feel reluctant to answer the questionnaire, which may lead to inaccurate data and small sample size for this research.
So now we are going to talk about Chapter 3 Methodology. In this section, the main topic to be covered is research design, target population, data collection method, sampling design, research instrument, theoretical framework and method of analysis. An applicable statistical method will also be explained in this chapter. Research design. It is a strategy that the researcher refers to ensure that it is related to the research problem. It is to determine the factors affecting the mental and emotional health of employees while working from home compared to the office. Using the quantitative approach, a cross-sectional study will be used because this study will ask the responder about the factors effect of work from home compared to office towards their mental and emotional health. This study is a cross-sectional study conducted by a simple random sampling method. This research is used in collecting and analyzing the data. In this section, the description of the sample will explain the criteria that are taken from the population as for this research. To ensure that the researcher can generalize the results from the study sample to the population as a whole, the sample should be representative of the population. This research will be divided into two criteria, which are inclusion and exclusion. The inclusion criteria for this is all working population in Negeri Sembilan, since all the worker is in the list of sampling frame. While the exclusion criteria are for those who are not working or underage, such as primary and secondary level, internship student, part-time student, and unemployment. For employees who have been laid off or given temporary leave by the employer will also not be considered as respondent because they cannot access the difference between working from home and in the office. The total population of this study is 482,500 of employees that working in Negeri Sembilan from a different category of work, area or place and sector. The population data of total employees that working were obtained from Socioeconomic Report in Negeri Sembilan in year 2019. For the sample size of the study, a total of N was selected from a different category of work, place and sector. The sample size will be calculated by using the formula that has been shown. The formula was stated to determine the sample size. By using this formula, we will know the suitable sample size needed to use for this research. This research was conducted on all employees in Negeri Sembilan that representing the whole population. This study uses a simple random sampling technique. In this type of sampling technique, because the population size is huge, there is no constraint on the sample size that the researcher needs to construct and can collect a small sample very easily from a larger population. Thus, in order to clearly obtain the main objective of this study, the study will randomly be selected with different category of work, area or places their work and sector. The data that we will be using will be primary data, which is collected by the researcher directly from the respondent. The data collection method that we're gonna use is to obtain the data through an online survey questionnaire. An online survey will be used as it is the most suitable and flexible method to gain the data for the survey, especially during the pandemic of COVID-19. Using the online survey questionnaire, the questionnaire used will then be distributed to the respondent. Through an online questionnaire, not only will it be low in cost, but it is also convenient for the respondent to answer the questions on their own schedule and time. However, this can cause a low response rate as the data collection sample size may be inadequate as the respondent may ignore or overlook the survey, especially when they are unavailable during the time. Research instrument is a set of structured questionnaire that is being used. The questionnaire will be given with a cover letter that will be briefly explain about the objective to the respondent for what the researcher are trying to find. The questionnaire is divided into 4 sections. Section A for the demographic of the respondent, Section B for the mental and emotional health, Section C for the workplace health, and Section D for the work engagement. Section B, Section C, and Section D will be given to the with the Likert scale questionnaire ranging from 1 to 5. Figure 3.1 shows the theoretical framework based on the finding from the previous study, which shows that the factors that can affect the mental and emotional health of the employee. Based on the figure 3.1, the independent variable consists of gender, age, category of employee, workplace health, work engagement, and work status, as well as the factors that affect the mental and emotional health, while the dependent variable is the mental and emotional health itself.
Hi, for description of data, the source of data used is statistical sources which refer to the data gathered of official purpose and incorporate census. The source of data was gained from a website that is related to the research of our study. The variable used during the research are gender, that is categorical, and the type data is qualitative. And next is age, numerical, and quantitative discrete. The third one is category of employee, also categorical, and it's qualitative. Workplace health, numerical, quantitative continuous. Workplace status, home or office is categorical. The type of data is qualitative. And variable next is mental health. Mental health is numerical and it is quantitative. Also emotional health, numerical, and type of data is quantitative. The period to obtain the data by conducting the survey will approximately be around a month, 1 month. This is due to estimation taken for the number sample size needed for the research. For the data analysis, the data that collected were analyzed by IBM SPSS Statistical Package for Social Science, Windows version 24. So the researcher conduct data checking before proceeding with the actual data analysis. A pilot study will be conducted in order to check the reliability of the question in the questionnaire before conducting the actual study. This also used to collect information that will be used to calculate sample size, such as standard deviation value. For the reliability analysis, will be used to test the consistency of the characteristic. Cronbach alpha will be used to measure the internal consistency and skill reliability. From this study, use Cronbach alpha in the pilot study in order to check the reliability of the questionnaire. The acceptance Cronbach alpha value is more than 0.7 by Britek, Matera, and Rogoza in 2016. From the table of Cronbach alpha coefficient and reliability, for the less than 0.7, reliability was poor, and for 0.7 to 0.9, reliability was acceptable, and for greater than 0.9 was good. For the method of analysis, this section will explain the procedure of analysis that will use throughout the research, as the procedure and research conducting is to fulfill the requirement of the objective state. So the SPSS software is used for statistical analysis. SPSS stands for Statistical Package for Social Science, IBM SPSS Data Editor for Windows version 24. It also provides data analysis for descriptive analysis, prediction of numerical outcome, data transformation, graphing, and direct marketing feeder to control the data evenly. So the researcher conduct data checking before proceeding with the actual data analysis. So the researcher use descriptive analysis to analyze section A from the questionnaire, which is demographic profile. And the purpose of descriptive analysis in this study is to find the factors that affect mental and emotional health while working from home compared to office working. Next is dependency test. The dependency test is also called as the pair sample t-test. Compare the mean between two related groups on the same continuous and dependent variable. So dependent t-tests are appropriate when data is passed for assumption to valid result, which are: the first assumption is the dependent variable measure on a continuous scale. Second is independent variable should consist two categorical or related group. And assumption 3 is there should be no significant outliers in the difference between two related group. And last, number 4 is the distribution of the different independent variable between two related group should be approximately normally distributed. For regression analysis is to answer our second objective, that is the factor affect mental and emotional health while working from home compared to office working. So the first step in predictive modeling is regression analysis. For the purpose of research, parametric means that it make assumption about result. Regression is restrictive in nature because it's parametrical side. So it struggle to generate good result with data set that do not fulfill its assumption. So the first assumption here is there should be a linear relationship between dependent variable and independent variable. So an additive relationship suggests that the effect of X and on Y is independent of other variable. Second assumption is there should be no correlation between the residual, that is error term. So the third assumption is the independent variable should not be correlated. And assumption number 4 is the error term must have constant variance. So from this phenomena is known as homoscedasticity. So the presence of non-constant variance is referred to heteroscedasticity. For assumption number 5, the error term must be normally distributed. For model adequacy checking should be known by: first is residual analysis, mean that the mean of error is 0. If the sum of error is 0, it is not independent, but the dependency effect can be ignored in an analysis of residual if number of residuals n is large relative to the number of parameter. Studentized residual is it has approximately a student t distribution with n minus p degree of freedom. So the corresponding predictor error is error equal to y minus y hat. For multiple linear regression were used when to predict the value of variable based on the value of two or more different variable. So the variable that predict is called the response variable. So the variable that are used to predict the value of the variable are known as the explanatory analysis. So multiple regression also to find out that the overall fit to the model, and as you can see the equation of regression model as shown. Y equal to beta naught plus the beta 1 x1 plus beta 2 x2 plus dengan beta 3 x3 plus until beta 6 x3 because our variable have 6 variable plus error. There is a few assumptions when conducting a multilinear regression, which are first one is normality assumption. For normality assumption is mean by the point fit a bell curve shape before proceed with certain statistical tests. The method they are used in order to determine the residual are normally distributed is using a graph PP plot of residual. Second assumption is homoscedasticity in assumption. So the assumption of homogeneity of variance can be determined by plotting the residual value against fitted value. Third assumption is independent assumption. The assumption of independent it can be determined by plotting the residual value against run order. So the residual value will be at y-axis, meanwhile the run order value will be at the x-axis. So for the summary of data analysis, we have two objectives. Objective one is to compare whether there is a difference in the mental and emotional health of employee while working in office or home. The variable we can get from here is our x1 is workplace status and x2 is emotional health. The second one is our x1 is workplace status and x2 is mental health. So the method of analysis for this variable are dependent t-test. So for the second objective in summary of data analysis is to determine the factor affecting the mental and emotional health of employee while working from home compared to office. From here our variable is divided into two. So the first variable is y1 equal to emotional health. Then our x1 is gender, x2 is age, and x3 category of employee, x4 is workplace health, x5 work engagement, and x6 is workplace status. So the second variable that we divided is y2 is equal to emotional health, and x1 equal to gender, x2 equal to age, and also category of employee, workplace health, and work engagement and work status. So method of analysis for both variable are multiple linear regression. So for our conclusion, this research has been designed to collect raw data, structure and information in order to fully know the effect of mental and emotional health of teleworker during the pandemic of COVID-19. So it also explains the suitable sample size needed and applicable statistical method and all the component involved during the conduct of this research has also been explained in this chapter by my friend. The process of the research is prominent as it allows the project to include a detailed description of the preferred form for the researcher to research the use and data collection method. Thank you. That's all from us.
Thank you.